Thanks all those who just joined. We're going to get started in just a moment, so hang tight. Okay. All right. Well, hey everyone. My name is Beth O'Riordan. I lead commercial content marketing here at Best Buy Health. Thanks so much for joining today's webinar, Enabling Tech Waiver 101, Building a Successful Program for High-Need LTSS and HCBS members. You're going to hear from some really knowledgeable speakers here today. First, we have Olivia Adams, who's the Associate Director of Health Medicaid Sales and Engagement here at Best Buy Health. She's responsible for overseeing partner engagement and client support teams and fostering really strategic collaborative relationships with our Medicaid and Medicare Advantage partners. You'll also be hearing from Gabe Perez, who's the Associate Director of Health Logistic Management Services at Best Buy Health. And he manages the team responsible for scaling age tech and enabling tech programs. So they're going to kick things off by giving a quick overview of enabling tech waivers before really talking about what it's like to stand up a successful program. They're going to go into the background of Best Buy Health's enabling tech solution before sharing some really powerful member stories. We're going to end today's session with a Q&A. If you do have any questions anytime throughout today's webinar, just make sure to put them in that Q&A box on your screen and we'll get to as many as time allows. If we don't get to your question on today's webinar, we will certainly follow up in the next day or two with that answer for you. We will be recording today's webinar. We'll be distributing that recording and we'll also be distributing a PDF version of the slides for you to have as well. So please look out for those in the next few days. And with that, I'm going to hand things over to Olivia Adams.
Thank you, Beth. Good afternoon or good morning, wherever you may be. We really appreciate you joining us today. We're really glad to see such a strong turnout and really appreciate you taking the time to be here with us. For those who may not be familiar or currently partnered with us, I'd like to start with just a quick introduction to Best Buy Health. We are part of the Best Buy family. We really bring together the broad access in consumer technology, deep partnerships across tech ecosystem, and experience in aging and healthcare to deliver scalable age tech solutions to the people that need them most. In the Medicaid space, we support high need long-term services and supports members in living safely and independently at home for longer, using technology and really help to reduce reliance on a more costly institutional care setting. For Medicare, we combine leading age tech with Geek Squad services to help deliver a more connected, supported member experiences. So you may know us through our legacy organizations, Critical Signal Technologies or Link to Life, which represent the longstanding partnerships that became part of Best Buy Health through an acquisition. So with that context, I'm excited to go ahead and get started. We're going to jump right into a waiver and a program that Best Buy Health and myself and Gabe are passionate about. We've been working in the technology space for decades, supporting individuals in their homes, and we firsthand have seen the positive impact that technology can bring on people's lives and the value that it provides and supports. Addressing enabling technology within home and community-based waivers is becoming increasingly important as states and health plans look for a scalable, cost-effective alternative to institutional care and a more traditional home care model. What really makes enabling technology so valuable is that it helps people remain safely and independent in their homes for longer periods of time. So in many cases, it offers more of an affordable and sustainable approach while still providing the supports that individuals need. So when we focus on identifying the right mix of assistive and enabling technologies, we're able to really better align services with each member's unique needs. And at the same time, we can help reduce avoidable utilization of higher cost care settings. So for healthcare plans, the value proposition is really compelling. Research shows that for every dollar invested in enabling technology, there's approximately $9 in an economic benefit. But really the impact goes beyond the financial savings. These solutions can really help enhance member safety, improve their overall experience, and support greater independence that can really to more of a long-term sustainability of our healthcare and support systems. When people hear the term enabling technology waiver, the easiest way to think about it is as a Medicaid program that uses technology to extend independence and support people that are living in their homes. So before we dive deeper into technology itself, I really just want to level set on what enabling technology waivers actually are. At a high level, enabling technology waivers are Medicaid home and community-based services programs that allow states to use technology as part of the support system for individuals with disabilities and aging populations. So the goal is to really help people to live safely, independently in their homes and communities, rather than relying solely on a traditional in-person care model. So these waivers provide access to a range of assistive and enabling technologies that can include things like remote support solutions, communication tools, smart home devices, and other technologies that really help with daily activities and help stay connected and maintain independence. So how it works is it typically starts with an assessment to understand the individual needs. That assessment looks at areas such as safety, communication, daily activities, and overall independence. So, really, based on those needs, appropriate technology solutions are then identified and then implemented into the home of that specific individual. So those, again, those solutions can be things like sensors, smart home devices, communication tools, but importantly, the technology isn't deployed just in isolation. It's usually combined with education, care coordination, and ongoing support to ensure that the member is comfortable using the technology and delivering what the intended outcomes were. So that's really why these waivers matter. For members, enabling technology can provide greater independence, increased safety, and really the ability to remain in their home longer. For states and health plans, it creates an opportunity to use these home and community-based resources more efficiently to improve member outcomes and experiences and potentially reduce reliance on these higher cost care settings. So ultimately, enabling technology waivers are about using technology as a tool to support people where they want to be, which is in their homes and connected in their communities, and really just living as independently as possible. So I want to discuss the difference between assistive technology and enabling technology because we hear those both. These terms are often used differently across Medicaid programs and waivers. At its core, assistive technology refers to a specific device, a piece of equipment or product that helps an individual increase or maintain a functional capability. So think of it as a tool designed to address a particular need. Enabling technology includes assistive technology, but it expands beyond a single device. It brings together connected devices, smart home solutions, and integrated systems that work together to help individuals live more independently throughout their homes and communities. One way to think about it is that assistive technology often focuses on solving a specific challenge, while enabling technology focuses on creating more of a broader ecosystem that promotes, autonomy and a quality way of life. And so, but because of these differences, our approach is not to fit states into a single model, but instead we focus on understanding each of these state waiver requirements and then identifying the technology solutions that best support members' needs while aligning with the program goals and structure. So the terminology may be different from state to state, but the goal remains the same, and that's to use technology to help people live more independently and safely and successfully, just setting out their own choice. When we talk about who is eligible for enabling technology waivers, this is a question that we get asked a lot. So although eligibility requirements vary across states. Most enabling technology waivers are designed to support members who have ongoing long-term support needs and can truly benefit from technology that promotes greater independence. When we talk about who is eligible for enabling technology through Medicaid waivers, it's important to remember that eligibility can vary from state to state. So if each Medicaid program has its own waiver structure and requirements and approval process, there's still some common themes across most states. So generally, individuals must first qualify for Medicaid and meet the state's criteria for long-term services and supports. But typically, there needs to be documented functional need showing how assistive or enabling technology can support that safety and independence or ability to perform these daily activities. So once those needs are assessed, specific products and services are first reviewed and then authorized based on the individual circumstances, and the guidelines are established within those state waiver programs. So really the key takeaway is that while details may differ from state to state, enabling technology typically intended for individuals who need additional support to remain, again, independent and successful in their own home and community settings. And so for organizations working across multiple states, understanding that each state's waiver requirements is an important part of identifying the right technology solutions and ensuring that they align with both the member needs and really the program expectations. Now that we've discussed a little bit about eligibility, I want to take a look at the different types of technology that are commonly covered through enabling technology waivers. While coverage and benefit limits can really vary state to state, most Medicaid home and community-based programs support similar categories of technology designed to help individuals live more safely in their home. One category is smart home and environmental support technology. This can help include devices like smart plugs, smart lighting, video doorbells, and give those individuals control over their environment. Another important category is communication and engagement technology. These are going to be tools like your smart speakers, speech generating devices that help individuals communicate more effectively. They can help stay connected to caregivers or family members, but they can manage their everyday task on their own. Safety technologies are also a key component in many of these programs. Personal Emergency Response System, or PERS, include the mobile solutions, provide a direct way for members to access help quickly when they need it, whether they're at home or out and about in their community. Behind all of these solutions, there's a connectivity that makes them work. So that's why many programs also cover supporting technology, such as Wi-Fi routers. There's network hubs, and there's other equipment needed to create a reliable in-home technology ecosystem. It's really important to remember that enabling technology, it's not about a typical or single device. It's about creating a coordinated set of tools that work together to support an individual's goals. So in most cases, approved technology is really authorized for an initial period. We see often up to 12 months. At the end of that period, it's important that the members' needs and outcomes are reassessed to determine whether the technology is continuing to provide value, and whether there's adjustments or maybe even additional support that may be needed. So the real value isn't really in the device itself. It's really how the technology can really help someone, remain safe and independent in the place that they may call home. I just want to pause real quick and just share a resource that us at Best Buy Health have found valuable. As I mentioned, every state that approaches home and community-based services and programs and enabling technology differently. We have found that Advancing States provides a helpful way to explore state-specific waiver information. it's a great reference point for understanding how services are defined and delivered across different markets. So as we move forward, we'll focus on the common themes that we see across the states while also recognizing that each program has its own distinctions. And we'll share this information out following the webinar so you have it as a reference as well. So I just spent the first part of today's discussion just truly building a foundation around enabling technology waivers and the value that they can deliver. But really the next question comes, what does it take to build a successful program? Based on our experience at Best Buy Health, supporting health plans in states, we're going to walk through some of the key components that drive adoption, improve member outcomes, and help demonstrate the meaningful ROI. So we'll show you how Best Buy Health puts these components best into practice. When we look at what it takes to build a successful enabling technology program, there's a few components that are consistently standing out. It starts with a person-centered assessment, making sure that each member's needs are evaluated individually and that caregivers are involved early when possible is crucial. That assessment is what drives the right technology selection and really just sets the foundation up for success. Next is going to be the care team education. It's important to ensure that staff feels confident in identifying opportunities and truly discussing enabling technology with members. From there, there's operational readiness. That's critical. Having a reliable partner for ordering and fulfillment and delivering really ensures a smooth member experience. Because once technology is in the home, success really depends on the strong installation, the member education, but also that ongoing support that members will need so that they can feel confident using it day to day. Finally, measurement is key. So defining how outcomes like the return on investment and member satisfaction will be tracked to demonstrate will make an impact. So while Best Buy Health can support these components end to end, the key takeaway is that they need to be intentionally designed and connected to drive success. I'm excited for Gabe to join in on the discussion. He brings a strong passion for enabling technology. He's helped us with developing our own assessment approach, and he has seen firsthand what it takes to create a strong member journey. Gabe, do you want to jump on and share why the assessment process might be critical as part of the enabling technology program?
Yeah, absolutely. Thanks, Olivia. I think when we look at the assessment, this is really about who should lead the assessment process itself. And it's important to note that there's not a right or wrong process, and it's really about what works best for the organization and most importantly for that member experience. Everything that is focused here is about trying to achieve member outcomes and trying to make experience as good as it possibly can be. So if we look at the care team, if you keep the assessment inside of your own organization, your team needs to be able to have the right resources on what vendors and products might be available to them. The goal is really about finding the right solution to achieve the right member outcome. There are many vendors and they all can offer different things. And I think that's what's been really exciting about this space is everybody brings their own area of expertise. And it's not about what would work best for the member on paper, but what is actually going to come to life as a full solution to help achieve those outcomes. This model success really depends on how well you equip your own teams and help continue to educate them well and beyond from starting the process itself. And then if you look on the other side from a third party standpoint, this case is less about training the team and more about choosing the right partner. And where you want to make sure you work with them is to find some that will work with you to develop the right process hand in hand that works again for your organization and the member experience. This is going to be more focused on how well the vendor can coordinate with your specific care teams and really keep you updated on every step of the journey without this administrative burden that kind of can take place. Here, it's really about shifting from training to partnering with the right vendor. And the assessment is so critical, and there's a fine balance in underserving those members and also the opposite of providing too much technology, and trying to find that balance is really key. As you kind of think about ordering and delivery technology, once you've submitted and assessed the right technology, it's really about logistics from that point. So from a delivery standpoint, it's about simplicity and speed and getting the member the right technology they need. What I think we've also found is there is a balance between the product arriving too early, where the member could accidentally discard it, or if it's too late and having to reschedule an appointment because the product quite isn't ready yet. It really is thinking about that member experience end to end. And then when you get into the setup, it's not every member doesn't always have a caregiver available to be able to provide these solutions and install them. So having a partner to be able to set up the device, and then really going into adoption, that's where it's most critical in my mind. I think we can all say we've been frustrated with technology at some point in our journey. I know I have. It's truly about how you demo where the member is in the driver's seat of the experience. They're the ones that are pushing the buttons. They're the ones that are activating the specific personalizations that have been set up through a voice assistant, if you would. And we want them to feel confident. You want to feel them confident in using the technology well after you've left, and also use that time to be able to spark questions that might come up. What I find really interesting is, we talk about people getting frustrated with technology. You can see really clearly here in the first stat, if we really don't teach it the right way, members will not use it. So 40% of seniors say not being shown how to use something is holding them back from tech adoption in general. And then on the second side, we have to make technology feel simple and approachable and really reliably work for the member. Many questions can come up during the setup, but ongoing support is really critical as you think about how this continues to come to life.
Thank you, Gabe. So we just discussed the tools and resources that are needed to build a successful enabling technology program. Next, we're going to walk through the Best Buy Health Enabling Technology Program and how we partner with organizations to support members that are enrolled in these enabling technology waivers. So we're going to highlight the operational components that drive successful outcomes that include the close collaboration with members that Gabe talked about, but also the care managers, the caregivers, to really understand the member's living situation, physical capabilities, and individual needs. This personalized approach will help ensure a smooth onboarding process and a positive member experience.
Yeah, Best Buy Health, and it's hard sometimes for people to understand why Best Buy Health is in this. I think when you think about Best Buy, it's really clear that we create ongoing relationships with customers as they come into our stores. And where we think there's a perfect marriage is Best Buy Health is ultimately about how do we provide the best member experience. So we can take the product assortment from smart home and age tech devices to be able to support these members. This is really about identifying the right products that can achieve the right outcomes, whether that's accessibility, environmental control, emergency responses, or social connection. All of these pieces kind of go hand in hand. And while you have individual products that are kind of listed on the bottom here, it's really important to understand that many times these come together as a full solution for a specific member. It's not just about recommending an electric plug. It's about how do we actually provide the right full serve solution to achieve the outcome that they may want to have from that plug itself. And as we talk about really the member onboarding and the journey from start to finish, what we have thought through and really been thoughtful around providing that best experience starts with assessing the needs of the member. So where we know there's a personalized care plan in really understanding the member, the assessment can help us tie off on the solution of the recommendation. Technology assessment also helps us understand more about the member and where they're at in their technology journey. What we found is really trying to find and match those recommendations in the moment to be able to answer questions or concerns that may come up as we're identifying the right solution. There's going to be one-off situations where you have to take some additional research of what could solve those outcomes. But in large part, we've seen these solutions come through from start to finish where we could make the right recommendation and get everybody together on the same page of how to achieve those outcomes. We talked about ordering and delivering the technology, and where Best Buy Health has a key differentiator is taking advantage of certified Geek Squad health agents that are dedicated to be able to support this work. We allow them extra time within the home that's different than if you were just buy something off of the shelf in a Best Buy store. We know how important that onboarding experience is for that member. And so we take extra approach in trying to make sure that we can answer every question and help demo multiple times so that they can feel confident after we go through it. And then really it's the post-installation support of how do we check in to make sure that what we recommended is the right solution. It's 30 days. It's also 6 months down the road to really ensure, did we actually achieve the outcome we were hoping to, and how is it coming to life for those members every single day? A little bit more about the assessment here. I think a lot of it is around really pre-work and introductory of both the case manager and the member itself, but it's open-ended questions to have a dialogue. No one wants to get a questionnaire that's just multiple questions they fill out themselves. That's not why I think we're here and wanting to make an impact in this world. It's really about establishing a relationship with the member by using open-ended questions and helping identify how we can make a product recommendation based off of them telling us a story about a specific outcome. So you can see here, the example of have you ever missed deliveries, or people coming to the home and have reservations and who's at the door, or tell me about your everyday lifestyle and what you go through from start to finish. So it's less about, let me ask you questions so I can make a recommendation. That's what you can get inside of a store. We want to create a relationship where we can actually understand and also find some unknown needs as we kind of go through this in the recommendation. And then into the post-install and the impact validation, we really think about how we can continue to support those members. And I think what kind of goes perfect marriage of providing the assessments is around how we drive adoption through care team education. So technology changes every single day. I think you can turn on the news, you can find new technology that's coming out at any point in time. Where I think we found a balance is really trying to look at live engagement and on-demand support. At Best Buy Health, we really believe that adoption is a capability that we can engage through care team education, whether they're completing the assessment or not. Technology is always changing. And when we think about that live engagement, it's spending time presenting real life solutions that are making an impact, role playing how to have those conversations if that's an assessment that they want to be able to do, and even demoing new products and capabilities that maybe they haven't already seen of. And you can't always have live engagement in the moment, so it's also about having training sessions where they can come back and review what documentation is out there. Sometimes products are pretty quickly retiring in the product life cycle, and trying to stay up on what the newer ones that have been replacements is really key, I think, as you start to look at this overall process. And then lastly, we talk about trying to measure the impact, and where think that the biggest impact is we want to understand where the member experience is coming and how we're actually making an impact in that every single day, but then also in the health plan. So from a member perspective, It's validating that the technology that we recommended is truly solving the members' unique needs. This is through a follow-up call to see how the installation actually went with the Geek Squad Health certified agents. It's ensuring that there aren't questions that were sparked after the agent left, because that's sometimes where myself, I think of things after I've had the opportunity to ask. So we want to have that forum to be able to answer things that may come up. And then again, it's about the 6 month follow-up and how do we continually stay engaged in the member journey from start to finish and how we can provide that right support. Um, Understanding that, if there's a recommendation that we make and we want to have a complement to that recommendation in the future, what could that look like? And start to think about that next life cycle of the next 12 months. If they do have some additional funding that's released, what can we continue to try and think about solving? And then from the health plan, it's really validating that the technology recommendation is driving ROI through claims data and trying to make an impact in the claims-based studies. It's really important at the end of the day that you tie both of them together. I think if you provide a really good member experience and there's no ROI, doesn't make a ton of sense. But if you can find a common marriage between the both, it will be a lot easier to scale and sustain these programs overall. And I think as we kind of talk through, I want to pass it over to Olivia. It kind of talks about our program and what we've seen thus far.
Thank you, Gabe. Appreciate it. This slide here highlights some of the products that we commonly see that are recommended for members following the technology assessment Gabe just walked us through. In many cases, members start with the foundational technology like video doorbells, smart lighting, and smart locks, tools that help them become more comfortable using technology in their home while immediately supporting their safety and independence. But as members build confidence and experience the benefits, additional solutions are layered over time to further support their daily living and long-term independence goals. So it's important that there's a short, streamlined time frame from assessment to approval to the installation in the home. This helps prioritize member safety. It avoids unnecessary delays as needs can change over time, but it supports a smoother, more positive onboarding experience for the individuals. These recommendations are also driven by the members' individual needs that are identified through that assessment process that we just heard about. But really the real value isn't just in these devices themselves. It's in the difference that they can make for the members and their caregivers. So I want to first see how, show you guys how these certain products show up in a day-to-day experience for these members and caregivers. So what you're about to hear are some real stories from members that are actively receiving enabling technology services today through Best Buy Health. Here we have a member that was facing mobility challenges and was at risk of needing a higher level of care because she wasn't consistently able to reach the door for meal deliveries. So working closely with their care manager, we were able to put a solution in place that included a video doorbell, a smart lock, and a smart hub. Because with this setup, she's now able to speak with visitors. She can receive audio and video alerts and remotely grant access when needed. So as a result, meals can safely be delivered directly to her home. This has helped her maintain her independence, and she's able to continue living at home with greater confidence. Another example is this member was using multiple extension cords and power strips throughout their home, which created a clear safety and tripping hazards. At the same time, they were very intentional about wanting to keep their existing setup, including antique lamps they had and just familiar household items. So instead of changing their environment, we focused on adapting it. We introduced smart plugs and a centralized smart hub that allowed them to turn their existing devices into voice control technology. So as a result, it's much safer and less cluttered in their home while we still preserved their comfort and control in their own environment. Another example is this member here has arthritis and difficulty reading and was experiencing increased social isolation in their home. And so through a smart screen that we're able to set up and install through Geek Squad, this really enabled voice controlled access to daily news and sports and connecting with their loved ones. And this member was able to learn how to use video calling to stay connected with family, and voice commands for added safety. So this technology really helped reduce the isolation that increased and improved their engagement and increased their independence and confidence in their home. So this really concludes our overview of what it takes to building a successful enabling technology program, as well as the approach that Best Buy Health has put into action. We covered some key components that include member-centered onboarding, streamlined operations, just showed some real-world outcomes that demonstrate the impact in the home. We are happy to open it up for questions or feedback or discussions. So feel free to ask any questions around whether it's program structure, technology solutions, or member experience. We welcome any feedback.
Great. Thanks so much, Olivia, and thank you, Gabe, for a great presentation. We have just under 10 minutes for some Q&A. So like Olivia just said, if you have a question, feel free to put it in that question box on your screen, and we'll get to as many as we can. I'd like to kick things off. We got a few questions around this topic, and so I'm gonna ask it in a more generic way, but I think we'll get to the questions that were asked about it. And I think this is for you, Olivia. It says, how can you basically prove out the financial impact of an enabling tech program?
Yeah, great question. I believe with a comprehensive ROI framework, we should be able to evaluate healthcare utilization. What are the member outcomes? What is the caregiver impact? So there's certain factors that can be measured, and so health plans and state agencies can really demonstrate how enabling technology not only generates the financial value through these avoided costs that occurred through enabling technology, but they're also what is the value to supporting the safer, independent living and outcome for that member in the community. And so these are things that Best Buy Health is able to work with these healthcare plans and states on to demonstrate the ROI.
Wonderful. I think the next question will also go to you, Olivia. It says, are you able to deliver services, including assessments and follow-ups, to rural members?
Yes, absolutely. So I mentioned the different types of technology that can be supported for individuals in rural communities. And so it's really important for us to understand some of the restrictions that the member may be experiencing and what their goals are for their individual living goals. And so the key would be, having that discussion with the member, doing the technology assessment with the member, and then having, Best Buy's Geek Squad expertise and understanding what are those products that will best suit those members, specifically for them to be able to remain living in that rural setting. Great question.
Awesome. Gabe, the next question is for you. It says, how can you empower members to use technology to meet their specific needs as opposed to having them use it more generically? And I think a good example of that would be something like a video doorbell.
Yeah, I think it's first and foremost understanding what outcome they're actually trying to achieve. Many people go into a Best Buy store or on Amazon or many different places to buy a Ring doorbell because they like the idea of actually seeing who's coming to the door. In practice, though, I think more of us are using it less and less and less for the intended purpose. So it's understanding what outcome are they trying to achieve. When we go back to those specific examples, we've seen quite a few members that we've helped serve where there is this fear in answering the door. They're not sure who's there. They want to have confidence and feel secure in their own home. And they also want to make sure that they don't miss key vital services to them being able to stay independent at their home, like meal services. And so it's the combination of using an Echo Show or an Amazon a voice assistant to be able to see and hear who's at the door and have a conversation and determine if they want to let them in. And as I talked about earlier in the demo piece, I think that's where it really comes to life, is showing them cool, this is a video doorbell. I think most people know what it does, but let me show you how it actually comes to life in your everyday life and how you can use it. And let's practice to make sure that you feel confident in using the product after I leave today.
Great. Thanks, Gabe. Um, the next question is, does Best Buy Health work through the state's Medicaid program for enrollment and credentialing? And kind of a second part to that is, how do we know Best Buy Health is credentialed in our state?
Yeah, I can take that. So as Best Buy Health supports Medicaid waivers on a national level, we credential for a variety of Medicaid state waivers and across states. So if you are interested in wondering, we can definitely have that conversation. We can look up our specific credentialing under specific waivers and let you know if that is a current state we are supporting today. Of course, if it's not a current state or waiver we are supporting today, we'll take the appropriate actions to become credentialed with any specific waiver that's required to support these healthcare plans under these waivers.
Great, thank you. The next question, is the program only offered to waiver participants, or can someone who does not meet the financial requirements of the waiver access these services? Olivia, can you take that one?
Yeah, so while we're speaking on assistive and enabling technology waivers today, because we've seen the impact and we're currently partnered with Medicaid plans to support these waivers today, we've been in the consumer space for decades. So Best Buy Health or Best Buy, offers these products and technology services. And so if there's individuals that are looking for these specific products, we're able to help understand kind of what their needs are. We can recommend products, but this is available in the consumer space as well. And then for any Medicare plans, we can offer this as a sort of a supplemental benefit offering or determine what is the best approach to be able to offer this to their Medicare members. But again, something that we've been doing in the consumer space for years.
Wonderful. I think we have about 3 minutes left. Let's see if we could get a couple more questions in. We got a few questions. So Olivia and Gabe, can you support a home modification waiver?
So yeah, I talked a little bit about assistive technology versus enabling technology, and so something that does get asked to us quite a bit is around home modification waivers that exist today throughout states. So Best Buy Health's age tech offering really focuses on enabling technology and health tech devices that support, the independence and well-being. Our scope doesn't include home modifications or structural changes to a residence, if that makes sense. So things like ramps, grab bars, or remodeling projects. So while these modifications may be covered under some assistive technology waivers, they are generally considered environmental or home modifications rather than the age tech solutions. That is the Best Buy Health scope.
I think, Beth, to add to that too, I think it's really important that we're clear on where we know we add value. Geek Squad has been around for 30 years now. We just celebrated our 30th year anniversary this last year. And we add value when we can enable technology inside the home through this member onboarding and through our product assortment that we have available through Best Buy. And so we want to stay focused on where we know we can continue to add value. The home modifications isn't that space for us. And I think it's being clear as a vendor where we know that we shine and where we don't.
Great. Thanks to you both. We have just under a minute left, so I just want to throw it back to Olivia and Gabe for any parting words, but just want to add to everyone in the audience, thank you for joining. We will be sending the recording of this webinar and a PDF of the slides. But if you have any additional questions, please reach out. And then Olivia and Gabe, any parting words before we close things out?
Just appreciate your time today. Again, this is something we're really passionate about, and we've seen true value and in real member testimonials that we shared today. So we'd love to be able to, expand this offering to you and your individuals, and even collaborate on how to, with any questions that you have. We'd love to have a discussion with you.
Yep, just echo. Thank you so much for having the time and listening to the recording. We know that Best Buy and Best Buy Health can add value to the members' life and journey. We want to be a part of it. So please reach out if you have questions, and let's see how we can work together to achieve those outcomes for the members.
Wonderful. Thanks, everyone. Have a great day.